Thank you, everyone. I will not take much of your time now that it's towards lunch. My name is Edith. I work for Pact World, leading the Strategic Information Systems Management. I worked with IntraHealth International, leading the digital health, deploying and developing electronic medical records in different health facilities in Rwanda, and led digital health initiatives within the Ministry of Health. Without taking too much of your time, I'll introduce Brian. He's been introduced in the previous session. In interest of time, I won't go through that again. I'll go straight to asking Brian, how can Rwanda provide better than world-class cancer care? I would like you to talk about systems, the failure of systems, and a better way forward.
Okay.
Please.
Great.
Thank you.
Thank you. And thanks for saving the time. I have some slides that I'd like to use to support I'm talking. What I would like for this to be is just kind of a quick run through of some thoughts, some observations, and some ideas that then would start a discussion that we can have during lunch, that we can have over the next few days, and hopefully the next many years. And everything just vanished. Can we have the slides back, please? Thank you. I realize how provocative this title is. I get it. I've been here, and when I talk about better than world-class healthcare, people looks at me like, are you an idiot? My ex-wife would definitely confirm that I'm an idiot, but that's beside the point. Okay, so main takeaways. Yeah, that was a joke, and my ex-wife's son is actually sitting here. My son Casper, but that's besides the point. Okay, some things I want to get right on the table first. The healthcare systems in the high-income countries are failing miserably. The U.S. healthcare system's falling apart. It's a disaster. Most European healthcare systems are a complete shipwreck. There are isolated pockets of excellence, but as a system, as national systems, they're just dying and they will implode. Cancer care is changing in how everything from the diagnostics on to the therapeutics. There are many new technologies as well as methods that are available. However, this is not going to be a talk about cool new technologies, but the interesting takeaway is even though there are many new technologies and methods, the systems in the higher income countries cannot adopt them because of their legacy infrastructure. So there are great new ways of doing things, except, well, they're just not doing it. For example, using AI models for radiology diagnostics. We've been able to do this for 10 years, definitely for 5 years. Zebra Technologies out of Israel has had workable models for years. Been applying for US FDA approval and never getting it because there's 33,000 highly paid radiologists in the US who are members of the American Medical Association, right? So this is important. Countries that have a blank slate, a green field, can create better. That's the foundation method. System thinking is the way forward. And how do I go to the next slide? Quick little history lesson. This is London back in 1854. There was a massive cholera outbreak. Many of you have probably seen this exact study, those of you that were public health people. It was believed that the cause of the cholera spreading was due to bad air, that it was a particulate matter floating around in the air. However, it was found that it was not bad air, that it was actually due to where do I point this thing to make it work? To a water pump where there was in the water supply was the source of cholera spreading. And that was pretty much the beginning of epidemiological studies, public health, Because what we have learned, if I was to ask you what has contributed more to the health of the public globally throughout history, it hasn't been a pill. It's not penicillin, right? It's not an antibiotic. It's no kind of a medication. It's not a surgical procedure or surgical procedures. To my friends at Electa, sorry, but it wasn't a piece of big, expensive medical equipment. And it's certainly not a fancy, famous hospital. What has contributed the most, hands down, without question, to the health of the people has been sanitation and access to potable water. It was done by engineers, like the one sitting right here next to me, right? Creating systems. This is the US healthcare system. As I said earlier, it's failing. Now you can, maybe I'm being hyperbolic or melodramatic or whatever it is. It is unsustainably expensive. No one challenges that in any way. The population is aging. It will get even worse. What you may not know is that 66.5% of all personal bankruptcies in the US are directly attributable to medical expenses. So yeah, you can get access to that great care, and then you will file personal bankruptcy. There are hospitals costing to be built well over $1 billion, with several of them being $2 billion and $3 billion. This is simply ridiculous. There is no need on earth for a $2 or $3 billion hospital. And these happen to mostly be with not-for-profit organizations for tax reasons. They're unsafe. I know it sounds horrible hearing these things, and you hear an American bashing the American system, but this is all researchable. It's estimated that the third leading cause of death is hospital-related errors. These are systems errors in hospitals. It's not doctors making a boo-boo. These are systems errors in hospitals that are avoidably killing people. It's estimated 5 times those numbers are avoidable injuries and lifetime disabilities. This does not sound like a great system to me. Life expectancy in the US is declining. Good healthcare? Good healthcare system? Doctors and nurses are killing themselves. The suicide rate among healthcare workers in the US has been increasing for years. 20% of doctors are considered leaving practice, and 40% of nurses just getting out. They're just tired of it. Every physician friend I have in the US is pissed off. Not the kind of place I want to work, and certainly not a healthy system. There's been a nonstop increase in the closure of healthcare facilities in rural areas. Lack of healthcare services in rural areas. It sounds like I'm talking about Rwanda. No, actually, that's not true, because I've been around the rural areas, and there's some really great rural healthcare services, better than rural US. So when I'm talking about failing systems, this is what I'm talking about. Globally, we did some research on building new hospitals, because this is something where we all want help with. We all want these really smart people to come teach us how to build hospitals, because we don't know how to build anything. This is a subset of a larger study of major new hospital projects around the world. On average, 118.36% over budget, including that brand new Karolinska Hospital in Sweden. What a monster. With an average delay of 3 years, with some of the projects being delayed as much as 10 years. The systems problems, it's not just about cost and safety and other things, they're also missing opportunities to do things. I'll just give a couple, just real quick, because I know we've got to burn through this faster. Regarding cancer, I did a project with Mayo Clinic a few years ago in Dubai. It was a partnership thing. And we were looking at systemic therapies, immunotherapies, chemo and everything, asking what percentage of all of your systemic therapies could be provided in the home, because they can be provided in the home. Mayo told me that in the US, 5% of our systemic therapies are provided in the home. I said, oh, wow, I would have thought it would have been more than that. But then we went on, but I went back to it, and I said, I have a question. You're only doing 5% in the home. I said, is that the most that could be done in the home? They said, oh, no. We could do clinically safe, better outcomes, 30%, 40% of systemic therapy. They're not reimbursed by the insurance company. System failure, right? They have the provider that could provide it in the home, but the insurance company's not reimbursing because the regulator, these are all your component parts, hasn't yet approved it. White blood cell, where'd it go? White blood cell count monitoring for neutropenia. I always say that wrong. Someone here knows how to say it properly. You can now do self-administered white blood cell testing in the home with some relatively inexpensive technologies. Okay, it would save money. It would be better for patients. It's really wonderful, except it's not happening hardly anywhere because it's not reimbursed by the insurance company. It would save the system money, but the system's broken, so it's not happening. I'll speed up a little bit. This clicker's killing me. Digital transformations, they fail. We can talk about that tomorrow. This is a good article about a friend of mine, Gil. Like, everyone knows the ecosystem's fragmented and broken, but no one's doing anything about it. Donald Trump's not going to do anything about it. I mean, you know, why? Why is that happening? Because a system is components of subsystems and more subsystems. For a system to be effective, all of the subsystems, the goals of the subsystems must be aligned and supporting the main system. That is not happening in the US and in most of the healthcare systems around the world. Their systems are failing. Please do not copy them. You guys have sort of a blank slate. I know it's not completely blank, but you don't have to unwind a monster like the NHS in the US, so use that opportunity. It's not a curse. Not having is actually a blessing. I spoke in Mekelle in Ethiopia 10 years ago when I was working on a project there, a subspecialty radiology training program. And I got up in front of everyone and talked about how lucky they were. And they looked at me like I was a nut. They're like, you're from the US, you're lucky. We're not. I was like, and I said the problem, and I said it exactly this way. You should have seen the look on their face, and I have some Ethiopian friends here, so I can say this. I said, the problem with you Ethiopians is that you're Ethiopian. And you should look, what? You can't talk like that. What do you mean? And I said, it's the same problem that me Baltimoreans have because I'm Baltimorean. I grew up in Baltimore. I was born in Baltimore. In my mind, Baltimore's always going to be the same way it always was. Right? I'm stuck in that paradigm because and when I, that's but it's not. It's not today. It's changed in the 30 years that since I left, but not up here. And the same thing when I look at Ethiopia or I look at Rwanda, and I'm talking to people from here that maybe you're stuck in that same, this is the way it's always been. But I don't see that. I see that, right? I see it as an opportunity and potential to create better healthcare systems and possibly some of the best healthcare systems on earth. But I do know that if they're not planned, monitored, and managed, they will fail. All of them always will fail. Unbreaking a broken system, it's like trying to fix the traffic in Bangkok. You can't. Doesn't work. Doesn't happen. Providing better cancer care will not be found in a pill, a scalpel, machine, or a building. It will be by building a national healthcare system. And that was the gentleman from Partners. He used the word system at least 10 times, right? But we hear about so many other words, strategy and plan and policy and all these other things. The word is systems. Cancer care is changing. The old cancer care in big hospitals, reactive, normally late stage, all about cutting and burning and poisoning. More of an impersonal shotgun approach that really wasn't very effective, very transactional. Come in for your surgery, come in for your radiation treatment, get your injection of your hormone therapy and go home. New cancer. Hospitals should be smaller. Should be much, much smaller. Care should be out of the hospitals, into outpatient settings. Over 60% of cancer surgeries can be performed in an outpatient setting. Cancer care, when I was planning my last cancer hospital in the UAE, people would say, Brian, what are you working on now? I said, I'm building a home care company. They're like, you're building a home care? I thought you're building a hospital. Yeah. There's going to be a little box of beds somewhere, but there's going to be a really cool outpatient center, and there's going to be advanced care in the home. And that's where most of the care will be delivered, right? Got to get my palliative care friend over there. More predictive, and I'll explain what I mean by avoiding in 1 second, what is tied to Jerry's mentioning about pharmacogenomics, precision, and about relationships. Cancer, you don't get cured. It's not a cure. So it's not a transaction. So when someone gets cancer, they got cancer unless they pass away. I can say that from personal experience. The majority of cancer care should be outpatient and in the home. And it needs to be developed at a national systems manner. Really quickly about systems in general, everything is systems. The planet Earth is a system of systems of systems of systems. The human body, system of systems of systems and subsystems. An organ within the body. Who knows what this is? What organ in the body is this? No, it's a prostate. Whose prostate is it? It's my prostate, except it's no longer my prostate because they took it out because I had prostate cancer. So I'm speaking to you as a patient, and I'm feeling fine, by the way. Thank you. Already beat on this, system of systems. You got that part. Okay, take a picture of this one. This is, if there's going to be a national cancer system, and I've done a little bit of research, Rwanda's already doing a lot of this stuff. A lot of the pieces are already in place and going forward, so I'm just kind of preaching to the converted saying, keep going. The goal of all the subsystem goals need to be aligned with each other, so horizontally and vertically, and they all need to support the mission of the main system. Number 4, this must happen at inception, by design, intentionally. If you allow for your system to grow organically, you'll get America. You'll get the traffic in Bangkok. Right? And unwinding and organically and grown disaster normally never happens. Must be mandated, enforced, and incentivized. I know right now there's undercapacity. So there's a desire to, let's do more hospitals, let's have more of everything. Granted. However, I highly recommend that there's consideration for something called a certificate of need, where no one can open a new healthcare facility unless there is a demonstrated need for it, that this is actually a government regulation. Right now, there'll always be need, so everyone will get approved. However, in some geographies, when you start reaching supply-demand balance, it should stop. People should not be allowed to build more facilities. The reason being is once supply crosses over demand, not only do the facilities start losing money, which, what do you care about if some private place loses money? They become unsafe. I have a whole presentation about why they become unsafe. So it's not just like, because you go to Dubai, the average private healthcare facility is only 47% utilized. They are dangerous. And also when they're losing money, what's happening? They're not paying their staff. They have high staff turnover, makes it even more unsafe. So certificate of need, good idea. Set the policy now so that later on you don't have a big political battle about the thing. National Cancer System, while a hospital is certain